Hi, I'm Dr. Paul Fisher with Gold Coast Chiropractic, and today we're going to talk about what some of the treatment options we have in this office are for spondylolisthesis in our third part of this video series. So one of the things that we work a lot in this office is restoring normal posture and also really improving core strength and core stability. One of the things we found that's very helpful for that is called a power plate. Now we have multiple of these machines throughout the office, and they've been really phenomenal in helping us accelerate patients' recovery. And also what's great is we have some patients that are so injured and so deconditioned that they're really limited to what they can do at first. And what happens with the power plate is we're actually able to kind of trick the body to get it to work harder in a way that's pain-free. So we're able to actually get patients who are very acute, get them moving in the right direction sooner. This has been a phenomenal device. We've got different models of it in the office based on what we're trying to accomplish. The one you see here, typically with this, we're doing more global activities. We're looking for core strengthening, core stability, more mobility issues. We've got two smaller ones that we work a lot with posture alignment. Now for spondylolisthesis, this becomes huge because, as we said before, so many patients are shifted forward like that. What the power plate allows us to do is really work to restore that normal alignment. Power plate's a whole body vibration. So actually what it does is it stimulates the body so you're getting more of an input, so you get a better response. It's like doing more exercises in the same amount of time. We use these mostly for therapeutic and for clinical, but these devices are used in sports teams, Division I athletes. They're really just allowed to, whatever you can do on one of these, this will just make it a better exercise and more productive. Next, we're going to show you what some of our traction options are in the office. This is our office's dinner roll table. Now, what the dinner roll table allows us to do, especially with this arm, is to be able to very specifically target where we want the force application to go to effectively remold and remodel the shape of the spine. The way that traction works is it works on the body's ligaments to stretch out and then set into place in what should be the body's normal alignment. This becomes extremely beneficial for patients with spondylolisthesis. It's because we're able to actually elevate this and really target a lot of force right across their lower abdomen to really shift those bones back to where they're supposed to be. This is also phenomenal for our patients who have scoliosis and for a number of other alignment issues, because this really allows us a lot of freedom with what we can do with the patient, where we can address it. And we've got a number of other devices in this office because some conditions respond better to patients who are supine or laying down. Others respond better to patients who are sitting, and just the whole gamut. So it's nice to have a number of different options in the office. And then the next one we're going to show you is one of our standing tractions. And this is actually the treatment photo, the post x-ray that we'll show from what we showed on the exam x-ray in our previous video. This is our standing traction unit at the office. Now for our patients with spondylolisthesis, this is great too, because many times this condition can get to the point where patients are so arthritic, or it's just very difficult for people to lay down and get up. So what this allows us to do is to still get that same change that we're looking for in a position that's more comfortable for the patient. And the way we have patients in here is they'll stand here, there'll be a block based on where the x-ray findings show us, and then we're effectively bringing their upper body back over to work to shift that spondylolisthesis back to where it's supposed to be. And as you see from this x-ray here, the results of this can really be quite impressive. And what's great about this too is because this is standing, it's easier for some patients just to get in and get out, and then as they progress through care, we can move them up to one of the lying tractions where we're able to do a little bit more force. But we've got to really work with what the body shows us. So some patients, we just have to start slower and work our way up. And for other patients, we're able to start a little bit more intensely at the beginning. But what's nice about having a lot of options is this really allows us to meet our patients where they're at and not based on what our equipment says. So again, I'm Dr. Paul Fisher with Gold Coast Chiropractic. I hope you enjoyed this video series on spondylolisthesis. Thanks and have a great day.